Welcome back, graduates. Thank you for returning to our NCLEX review series. In this presentation, we will focus on health promotion and maintenance. Let's get started. The client need area of health promotion and maintenance can account for 6 to 12% of the NCLEX PN exam. This category focuses on how the LPN provides nursing care for clients that incorporates the knowledge of expected stages of growth and development and prevention and/or early detection of health problems. Questions in this area are centered on the learning objectives of the aging process, maternal and newborn care, community resources, data collection techniques, developmental stages and transitions, health promotion and disease prevention, high-risk behaviors, lifestyle choices, and self-care. In the following slides, we will dive deeper into these individual objectives. Questions within the category of the aging process can cover physiological changes across the lifespan, anywhere from newborn clients to adult clients over the age of 65. This will require a good understanding of physiological changes of men and women across the age groups and key care needs that nurses will work to address of those populations. Some examples of scenarios that may be presented can include identifying care needs of all age groups, such as immunizations, nutritional support, and key times of health screenings. Also understanding physiological reproductive processes, even including menopause. Your overall understanding of your role as a nurse in reinforcing care needs for healthy individuals across the age groups is key in this category. The specialized area of maternal newborn care is definitely one that I hear a lot of concerns from many nursing students in preparation for NCLEX PN. Fortunately for you, this is a smaller area of your NCLEX PN exam, and the NCLEX PN test plan is your friend. Reviewing the key areas that are listed here on this slide can absolutely take you far. In the realm of health promotion, it is key that you understand the key nursing roles that will support healthy pregnancies and care of healthy newborns. Topics that can be included can center around nutritional teaching during pregnancy, comforting a newborn, feeding and bathing newborns. The goal is to identify nursing practices that support a healthy mom and baby. Understanding how to utilize community resources is a key portion of promoting health as our patients live within communities. The recommendations of the nurse will be dependent on the patient population, geographic locations, and cultural practices, just to name a few. In addition to identifying key social services, it can be of benefit to understand how environmental contaminants to water and/or food can be properly prevented in efforts to reinforce best practices to clients. Questions aimed at testing you on data collection techniques can definitely draw on your critical thinking, as well as on your health assessment understanding and skill. Obtaining pertinent health history for initial admissions as well as post-op data all require minor adjustments in data collection. Some portions of this will rely on subjective data, while other portions will rely on objective data. So remembering subjective data is what the patients will tell you, whereas your objective data will be items such as your vital signs or your lab findings. Developmental stages and transitions looks more closely at how our clients progress cognitively and emotionally across the age groups. It is key for nursing to understand or identify developmental stages as a measure of health and wellness. This is where those pediatric milestone markers definitely come into play. However, this can also be helpful in identifying appropriate activities of exercise for an 8-year-old versus a 12-year-old. As our clients develop, body image also becomes important, and it can affect emotional wellness. It's important for nurses to support patient concerns of body image, and while this can range from physical appearance during pregnancy to eyesight and hearing in older adults, each of them affect the client's acceptance of their body changes. The objective of health promotion and disease prevention is an essential category within health promotion and maintenance. Promoting health and preventing disease will differ amongst age groups. As you prepare for your NCLEX, it will be helpful to categorize key promotional health concerns for different populations by age and events. For example, key screening exams for newborns will differ for those versus adults over the age of 40. Questions can focus on prevention strategies for infectious diseases, the immunization schedule, and lifestyle choices that can prevent chronic illnesses such as cancers, cardiovascular illnesses, and diabetes. The nursing role is to help reinforce key teaching around disease prevention, as well as document health behaviors appropriately. Please see the continued list of topics that can be tested on in this category. Health screenings play a large role in early detection and treatment of cancers, cardiovascular illnesses, and diabetes, just to name a few. In your preparation, it can also be helpful to review screening exams by body systems and note key nursing roles in preparing clients for those screening exams or performing the screenings appropriately. Helping clients identify high-risk behaviors also can have a great impact on disease prevention and in turn promote wellness. This can include behaviors related to use of substances and alcohol, to use of sunscreen and exercise, or even sexual practices. In each case, the goal is reinforcing teaching that emphasizes for clients ways in which they can prevent risky behaviors and encourage options that improve health. Lifestyle choices can definitely impact health wellness. The nursing role is to reinforce teaching to help ensure that clients are aware of how their choices impact their health and their wellness. For example, if a client chooses to use oral contraceptives to prevent pregnancies, it is important that the client understands how to properly use them in a way not only to prevent the pregnancy, but also to help prevent any additional unwanted health concerns. Smoking is only one example of a lifestyle choice that can lead to health concerns for a client that is taking contraceptives orally. Respecting clients' choices while ensuring and documenting teaching on health promotion is paramount in the role of the nurse. Healthcare outcomes can improve when a client is more able to participate in their own care activities. For clients at different levels of development or those recovering from physiological injuries or with chronic illnesses such as multiple sclerosis, nurses can play a key role in identifying which care activities in which the client can use additional support or provide clients with strategies on ways in which they can still accomplish these activities of care even in the times of impairment. As you probably noticed by taking a closer look now into the topics within the health promotion and maintenance client need area, the pediatric population is highly referenced. So for this presentation, we will look more closely at caring for a newborn client. It may be helpful for the purposes of continuing through with the case study in this platform to take a picture of this slide to reference the client information in later slides. In addition to identifying key elements that may be of benefit for newborn care, we will also dive deeper into strategies for the clinical judgment skills you will be tested on. Recognized cues questions can often include select all that apply question types. It can be helpful to process these with a true or false process of elimination, considering each answer choice one at a time and asking yourself, is this true or is this false as you go through the answer options. The items selected with the green check mark are concerning for a newborn and indicate a key feeding concern as well as hydration status concerns. It can be expected for newborns to spit up following feedings, have the soft spots to their head, also known as their anterior and posterior fontanelles. That is an expectation. They can have hiccups as well as retain that rooting reflex, especially in that first month of life. I often hear concerns of this question type for analyzed cues. It can be helpful to take this matrix table question type one box at a time, considering each finding individually against the condition. For example, urine output noted in the chart is either consistent with the tongue tie, true or false. And then before moving on to another column, finish comparing each of the findings individually against tongue tie. And then move on to the options for colic. So one box at a time. Hopefully using that one box method helped you get closer to selecting all of the right options. Remember, on NCLEX you have more time. So be sure to practice taking your time and not rushing yourself through these boxes when you see them or these tables. All of the findings here selected in green are consistent with infant tongue tie. Being difficult to console along with the frequent crying are the only findings that are consistent with concern of colic. Colic is a common occurrence in newborns due to an underdeveloped GI tract, which is often found because infants' GI tracts are continue to develop within their first 6 months of life. However, tongue tie is a condition that can be subtle at birth, so it may not be found until they're sent home, but it can definitely present big concerns with feeding, and it does need to be followed up on right away. Remembering here for our prioritized hypotheses, the priority is always the key emphasis. So the item that is of most importance. As you prioritize the options here, it may be helpful to reference the information in the chart for each option. And in a way, work to build up your evidence for each of the options, and then eliminate any of the options that don't really have sufficient evidence. Due to the findings previously listed of 3 wet diapers in a 24-hour time period, along with the difficulty feeding, this newborn is at the highest risk of dehydration. There is not sufficient evidence to support any concern of infection or aspiration. Again, for select all that apply, take in each answer option one at a time. You may also find it helpful to utilize will it help or will it hurt approach for each of the answer options. Working to keep or retain the options that you find as helping may be a good tactic for this question type. In the case of our infant that is experiencing tongue tie and is also at risk of dehydration, it will be helpful to refer the parent and the newborn to a specialist, monitor that hydration status closely, encourage frequent feedings, and consult a lactation specialist. Bottle feeding may not help improve the newborn's hydration status and can also interfere with the mother's goal of breastfeeding. It may not be helpful to the newborn to limit feeding duration or wait on the issue to resolve naturally. When working to answer questions under the take actions realm, and keep in mind this is typically going to be your 5th question out of the 6 questions on the case within the case study. This is often going to be an item of priority or a question of priority. So working to pick those options that are the best or of most importance can really be helpful. The items that will best address the mother's concerns and help improve the infant outcomes are monitoring the infant's weight closely and utilizing the help of that lactation consultant. There is no evidence to support using a pacifier will help. Less frequent feedings could be harmful to our infant who's at risk of dehydration. Use of formula exclusively also is not indicated. While the frenotomy may be indicated, it is not within the scope of practice for the nurse. And then bottle feeding and use of nipple shields may not help the infant if the mother is not aware of key techniques to help the infant latch better. Finally, water is not indicated for infants, and it actually can be very harmful. You see the updates of the infant at the 4-week visit after having a frenotomy. It may be helpful to take a picture of this slide. In order to evaluate your outcomes, it will be helpful to review each item in comparison to the facts of the client chart to help fill in the gap of what has happened, whether they've improved, remain unchanged, or declined. Upon review of the data against the findings listed here, you may have found that the infant continues to spit up following feedings, so the tolerance is unchanged. Clicking sounds have decreased, so this is an improvement. For tongue appearance, the tongue mobility has improved, so this is an an improvement. The infant appears more comfortable and consolable, so that is an improvement. For skin integrity, it is noted that the infant now has a diaper rash, and that is a declining finding. Wet diapers have improved and the infant is drooling, which are both improvements because this indicates that the client now has improved hydration, which is awesome. I hope that you have found this presentation and review of a case study in clinical judgment helpful as you prepare for your NCLEX examination. Please know that we are here to partner with you on your journey to becoming a licensed nurse. Be sure to connect with your campus NSS for additional resources and support on your journey. If you are a graduate of Concord, Sacramento, or South San Francisco, I look forward to hearing from you soon. Wishing you all the best.